med math, safe med exam, dosage calc, medication administration test, whatever your school calls it. It's that time of year where it's time to take another. So let's talk about my best tips and tricks to pass it on the first try, because nobody wants that pressure of having to retake that exam. And if it's the first time you're doing it, they've probably scared the crap out of you anyway. So I got all the tips for you. Okay, so first off, if you don't know what a safe med exam is, most nursing schools require you to take and pass it before you can administer medications at any sort of clinical, and then usually you have to pass it to be able to pass any of your courses in nursing school. So at my school, it's the courses that actually have the clinical component that we take the safe med exam in, but it may be different at your school. So typically I've taken it once or twice a semester. It kind of just depended on my course load, but basically what it is it's to verify that you understand how to calculate safe dosage before you're giving medications. So of course, as you progress through your program, it gets harder and harder, and the expectation of the grade that you have to get gets higher and higher too. So for my school, I know some schools are different. For 300 level classes, you have to get an 80% or higher, and it's a 10 question test, so 8 out of 10 correct to pass. And then for the 400 level, you have to get a 90%. I know some schools it's just 100% all the time, and to be honest, we're aiming for 100% anyways. So that's what we're going to talk about today as far as tips and tricks go. So tip number one is to sit down and do some practice problems. Even if you've taken the test before, it's your final semester of nursing school, blah blah blah, sit down and do practice problems, specifically if your instructor posts any, because more than likely the test is going to mimic those style of questions. So if you're doing their practice and you notice that there's a ton of like GTTs or like tubing drop based questions, make sure you brush up on those, you know all of your conversions, you understand how to do the problem, etc. I always use that as my study guide to cater what kind of questions I need to practice. And a lot of times I will Google an example question and just ask for similar questions. You could use ChatGPT for this if you're an AI person, or whatever AI platform you use, and they can give you more practice problems. And some schools even host dosage calculation practice sessions, or just post more extra questions on like their school nursing website. So go looking for those, practice those. I've had instructors make practice quizzes on ATI too. I've done those as well, but they're always kind of going to show you the blueprint to your specific instructor's test if your specific instructor is giving you example problems. For the love of God, do them. Next, what you're going to do is you're just going to run through all of the conversions. So get out a piece of paper and write down all of the conversions that you need to know for dosage calc, and then check those against the ones that your instructor, I'm sure, has posted for you to review. If you have an instructor that does that, or your school of nursing, or wherever you got your conversions from, just to make sure you're keeping all of those top of mind, because especially if you've taken a summer off, even if you've done dosage calc before, they're very easy to forget, and you don't realize that you don't remember them until you sit down for the exam. And then my third tip, which a lot of you are going to absolutely hate me for, but has saved me every single time I've taken a dosage calculation test, so please listen to me right now, is you're gonna take the test twice. I know it sounds absolutely crazy. You're confident in your answers. You just want to turn it in and be done. But every single time I've taken a dosage calc exam, I have caught an error that I made that would have caused me to miss a question when I did it a second time. So what I do is I use a piece of scratch paper, if you're allowed one, or I will just cover the answer that I put into ExamSoft if you're using ExamSoft for it, and redo the problem, and then check your previous answer and compare. So basically what I do is, a lot of my professors will let us use spare pieces of paper. So I take the whole test, I don't put any answers into ExamSoft if we're using ExamSoft, and then I flip my piece of paper over and I take the whole test again in the same order I took it initially, so I am hopefully not remembering all of the answers that I got. And then I check my answers to make sure they match, and the ones that don't, I do it a third time. And then finally, my last tip is to go through your exam one more time before you're submitting to verify that all of your answers match exactly what you had, and then also are following whatever the rounding rule is, because the rounding rule is something that can make or break you on a dosage calc exam, because they will argue that it can also make or break the dosage that you're administering to a patient. So making sure that you know what to the 10th place means, to the 100th place means, that's typically all they're going to have you round to. but double checking that your answer is following whatever that is as well. For instance, I know sometimes if it is a decimal, they want you to put the 0 in front. So if your answer is 0.52, you would put 0.52, but not a trailing 0, because that could lead to an error where somebody could view it as 520. So just making sure that you know all of the rounding rules and that you're double checking all of your answers. So that was a ton of information. Let me know down below if you've taken Dosage Calc before. Let us know if you have any tips and tricks that I did not mention to pass the exam on the first try. Let us know what your school requires as far as Dosage Calc scores go. I'm always curious to hear. And if you have any other questions, and best of luck on your upcoming Dosage Calc exam. You got this, you're gonna crush it.